A very good morning to all my friends and concerned patients and whoever have the disease. Today, I am Dr. Vineet Varghese, a neurosurgeon and spine surgeon practicing in Delhi, who will speak to you about stroke. Stroke with relation to the brain. Stroke is a condition which affects the brain somehow just like the fashion that heart attack affects the heart. It is an acute event, it is a very serious condition and affects millions across the globe. It is a very common condition, especially today with changing lifestyles, diabetes and hypertension becoming the norm of the day. It has become a very common disease. In that view, I shall talk about what a neurosurgeon and what are the places and time at which you should consult a doctor immediately when you have something called stroke. In Hindi, you call it as lakhwa, something like that. And what happens in this? First, stroke is of three types. One is a transient attack where you might have a mild slurring of speech or a weakness and it improves over the 24-hour period. Second is when the supply to a part of the brain stops. The third is when there is a bleeding occurs or hemorrhaging. Three of these types of strokes are all important, all require ICU stay, immediate consultation with a neurosurgeon inside a hospital setting and admission to the ICU. Why? All these conditions can be fatal and you may not have time to save your near and dear ones unless you are aware at what it entails and what it can possibly do. So what does it do? For a transient attack, a patient, what are the red flag signs, for example? 1. Patient has a loss of consciousness. 2. He might have a weakness of any of the limbs, upper, lower limbs. 3. There might be a slurring of speech or loss of speech. 4. There might be simply altered sensorium, that is, he may not be confused, may not be talking clearly, sudden memory loss. All this are a sudden event at any point of day, especially in the elderly, especially in a patient who is a known case of hypertension or diabetes, has to be taken very seriously. Immediately rush the patient to the emergency. It might be a simple thing, it might be a sugarless, it might be electrolyte loss, it might be a heart condition. But only after you ruled it out and then we go for a imaging scan, that is a MRI of the brain. MRI of the brain or CT of the brain where the MRI is not available will rule out the most lethal condition, that is a brain stroke. Once you have ruled it out or if the condition improves, you keep the patient in the ICU or intensive care for a day and scan is normal and the patient improves, then that is a transient attack and now you know that you are a candidate who can undergo a major attack in the future. So medicines are given to prevent further such events and you get a regular workup and a regular follow-up. In that fashion, you prevent a catastrophic event in the future. The next case, where a part of the brain loses a blood supply or bleeds. In these cases, you need a neurosurgery intervention where if that area damaged or the bleed is massive, immediate life-saving surgery is required, wherein we remove the bleeding or remove the bone so as to give space to the brain and hence save the person's life. If it is not done in time or not detected in time, both case, it is definitely fatal or the patient will be comatose for life. So this has to be done immediately. This can be only done in a setup. First, the patient has to be recognized, has to be brought to an emergency, ICU and further intervention can be done. But most cases, what happens is that they don't reach ICU, they simply have an attack on the way, have a convulsion fits और simply called दौरे हो जाते हैं, पता नहीं चलता, पहुंचते नहीं टाइम पे एंड फिर बचना मुश्किल हो जाता है. तो टाइम पे पहुंचना समझना ज़्यादा ज़रूरी है. एक बार पहुंच गए, समझ गए, then it can be done. So most of the strokes are either a small bleed or a small area of brain which is affected, which can be managed by medicines alone in ICU. If it is detected and managed in time, most of these patients get complete relief, some get partial relief which get better with physiotherapy and others get relief on medications over a prolonged period of time. But if no, and if they have no problems, they will get at least preventive strategies for themselves as well as for their family. That is, many of the diseases are hereditary in nature. So father, son might have it, daughter might have it. So they will be ready in the future, will take precautions with medicines and lifestyle modification, regular exercise, avoiding smoking, avoiding drinking, all these things which you do for a healthy heart, you have to do for a healthy brain. Frankly speaking, a healthy brain is equally important or more important, because if you are not functional, doesn't matter if your body, all organs are fine, because that is the main center. It has to be in perfect working condition. So once again, brain stroke is something which has to be considered very seriously. Everybody should know what are the red flag signs, when to consult a doctor, and what to do next. At least know the red flag signs being any weakness, कोई भी हाथ पैर की कमजोरी, दौरे और seizures और fits, any loss of memory, भूल जाना, any difficulty in talking, speech problems, which is of sudden onset, has to be taken seriously, shown in emergency and ruled out stroke. Once ruled out, good. If not, at least detected, it can be treated and safely treated. And most elderly and most patients nowadays in their 30s are affected by this. So please take care, and I hope you don't have the disease, or if you have, you'll come to know it in time and are treated well. You can contact me, Dr. Vineet Varghese, through Lybrate or the internet. Thank you for your valuable time.